So the first thing we're going to talk about is structure. Most people think about structure when they think about a chiropractor. Chiropractors realign the spine, and there's lots of different ways that, lots of different tools that we use to assess how is a structure out of place. Back in the early primitive days of chiropractic, D.D. Palmer was looking for the high spots, feeling for the lumps, and knocking them down into place. I think there's some chiropractors who still do that, but we use a lot of different tools. So when you come in for your exam, certainly we do have you lay down, feel along the spine. We're feeling for motion. The spine should be moving side to side pretty evenly. It should be moving above and below pretty evenly, so we're feeling for motion. We may also do a postural check where we have people stand in place, close their eyes, stand up straight, and see if there's a high shoulder, if the head is tilted, if it's rotated. Postural assessment. We also do a foot scan in the office. We have a foot scanner where you literally stand on a scanner. It takes a scan of your feet when you're in the weight-bearing position. A lot of times people have injuries or a short leg or some kind of problem where in their feet one foot is very different from the other. One leg might be shorter. So if the base is always off like this, then we can keep doing the adjustments, but you're always going to walk away out of adjustment. So if somebody has that kind of a problem, we have to address it. A very common tool that chiropractors use and have been using for over 100 years is X-ray. So we get an X-ray of the spine, and that shows us if there's any other reasons that the spine might be out of alignment. Sometimes people have a little scoliosis. Sometimes they have a vertebrae that are actually misshapen that'll never change. So the X-rays give us an idea of, can something be changed? Is there an old injury? Is there any kind of adjustment we shouldn't be doing? A lot of people also are a little afraid of chiropractors because they have a concept that you're going to twist somebody's head and kill them. It's probably not as easy as the movies make it seem, but there's all kinds of different techniques. If somebody has an injury or a sensitivity or a past history of strokes or anything like that, we would use modified techniques. So the techniques range from very gentle, using only 1 or 2 fingers, especially for a tiny little spine like a baby, to a really more aggressive type of adjustment for somebody who's big, muscular, sturdy. So there's all kinds of different ways that we address the structure. In addition to what we do in the office in terms of adjusting, when people have structural problems, we also may refer them to people who do yoga or massage or different kinds of structural approaches to help with the elasticity, the integrity of the joint. Exercise is also a really important way to address the structure. So part of what we do in this office too is not just passive care where we're working on you, but we're teaching you about things that you should be doing at home to help hold your adjustments longer and maintain the structure. Also, of course, ergonomics. How are you sitting at your workstation? What are you doing during the day? How are you sitting when you're driving? How are you moving when you're walking? Even how you're sleeping. The things like pillow height. All of these things play into the health of the structure of the spine.